arrhythmias, which are, irregular heartbeats. But let me just kind of go back. I think most of you know me, Cari Shulkin. I'm a cardiovascular nurse, and I have been one since I was 12. At least it feels like it. It feels like it. So all of this stuff is very near and dear to my heart. Again, pardon the pun, but I love this stuff, and talking about it and making sure you guys really understand it is really cool. But not only that, then being able to hear from someone who's been through it and their perspective as a patient getting this procedure, or what some of these arrhythmias actually feel like. Okay. So let's just start with the beating heart, because that's what our heart is doing right now, right? Don't have to think about it. It's just pumping. It's that contraction, those upper chambers, those lower chambers. That left ventricle has to pump blood out to everywhere. It's an amazing muscle, right? That beating heart. But that beat is controlled by electrical signals. There's electrical conduction system in your heart to make sure it's pumping correctly. So when you have an irregular beat or an arrhythmia, then something has happened in that electrical system. There's been a short circuit. And that short circuit can make your heart beat too fast, too slow, irregular, whatever. But it can become a problem. Okay, everyone with me so far? Yep, okay, good. So let's talk about some of the structures here. So, okay, we have the right atrium and the left atrium. Those are the two upper chambers. And then the right ventricle and the left ventricle. Left ventricle is very important because that's the big muscular chamber that has to pump blood, all this oxygenated blood out of your heart, and it has to be pumped to where it will go everywhere into your body. So that left ventricle is really important. I wonder if I can move this down. I don't want to mess with it. But inside that right atrium is the beginning of the whole electrical system. And there's a little area called the SA node, or the sinoatrial node. And it consists of a bunch of pacer cells. It's like, well, what the heck is a pacer cell? So I remember you probably all have seen maybe not an echocardiogram, but when you see, someone's pregnant and they show you the little ultrasound, and they just show, there's just these beating, you can see something beating. That's the first thing that develops in a baby in utero, is those pacer cells. And then they multiply and they multiply, and then they become the heart. And those pacer cells end up being the SA node. So they have these amazing cells that can conduct electricity and pace the heart. So the SA node is really, really important. And it's right there in the right upper atrium. And then off of the SA node, we've got these interatrial pathways, because we know that the electrical system is hitting the right atrium, but there has to be a pathway to hit the left atrium as well. There needs to be this synchronous beat, contraction. And then we also have an internodal pathway, which is the SA node, that this pathway comes down to the next node, which is called the AV node, or the atrial ventricular node. And that AV node is really important, because what it does, if you think about it, the SA node has the beginning of the beat. The electrical system starts there. And then that electrical signal goes down to the AV node, and the AV node slows everything down. We know that the atrium's contracting with the SA node, and then that pulse slows down when it gets to the AV node, because then it travels down a little bit farther to see how it bifurcates. There's the right branch bundle of his and the left branch bundle of his. So it kind of bifurcates, and one goes to the right side around that right ventricle, and the other side, the left branch bundle of his, goes to the left side of the heart around the left ventricle. And though that's exactly where the pathway goes for the electrical system to contract the ventricle. All these other little things, oh, you can't see it, but all these little blue things are the Purkinje fibers. And so those are extra parts of the pathway that are embedded in the ventricles that electrical impulse goes through and makes sure that there's a contraction. Have I lost anybody yet?
Is there going to be a test?
There is going to be a quiz. Again, I love this stuff. Okay, now I want to put it together and show you just a real quick video. Escape twice. No. Okay.
Is a beating muscle that continually pumps blood to the rest of the body. What we commonly call a heartbeat is actually the rhythmic contraction of the heart's 4 chambers. Each heartbeat is stimulated by electrical signals that travel through a specific pathway in the heart. These signals can be tracked and recorded by an electrocardiogram or EKG. The heart's electrical signal begins at the sinoatrial node or SA node, which is located in the top right chamber or atrium. The signal then travels to both the right and left atria, causing them to contract and push blood into the lower chambers or ventricles. The electrical signal continues into the ventricles via the atrioventricular node or AV node, and then into the tissue that separates the ventricles through the bundle of His. The signal continues down the bundle of His and into the left and right bundle branches, located within the ventricles. When the signal reaches the ventricles, it causes the ventricles to contract and pump blood to the lungs and body, completing the heartbeat. This system functions as the body's own pacemaker and keeps the heart beating at a normal rate of 60 to 100 beats per minute. If the activity of this system is interrupted due to heart damage or other medical conditions, it can cause the heart to beat at an abnormal rate or with an irregular rhythm. Should this occur, blood flow to the brain and other parts of the body could be compromised.
So I think, oh, here, let me go back to current.
Good.
So I think, so putting that all together, to me, it totally makes sense. But I think the key thing that was said is if you have an issue with the electrical system, it can cause a really big problem, not just a slow heart rate or a fast heart rate, but you can die from an irregular heartbeat. So it can be very, very serious as well. So let's talk about the types of arrhythmias. AFib. Who, by a thumbs up, who's had AFib? Look at it, it's very common. And so when you think about what we just talked about, the electrical system, so what's happening in atrial fibrillation is the atrium, that there's a short circuit in somewhere between the SA node and that internodal pathway, because the atrium are not contracting, they're fibrillating. And someone who's young, if they have AFib, it may not cause any big limitation because they're young and healthy. But older people like us, if you're in AFib, it can become an issue because what's happening is the atrium are not contracting and getting that blood down to the ventricles. So the ventricles are pumping out less blood. And so less oxygenated blood is an issue. So AFib, you can have this really irregular and it's a very fast heartbeat. We're going to talk about that too. There's bradycardia, which is a very slow heartbeat. And so there's a short circuit somewhere in the conduction system where it's slowing that heart rate down and maybe even skipping beats. Tachycardia, which also includes supraventricular tachycardia, or SVT. Anyone heard of that? Yeah, okay. That's a very, very fast heartbeat. And again, there's just this short circuit in that whole conduction system. Here are some other arrhythmias, like a PAC, which is a premature atrial contraction, which is just an extra beat originating from the atrium. Not that big of a deal, rather benign. A lot of people probably have PACs and it's not that big of an issue. Now there's PVCs, premature ventricular contraction, where that impulse is originating in the ventricle and that it is conducting an early contraction from that ventricle. So when you have a PVC, it can be a little worrisome. If you have a lot of PVCs, that can be very worrisome. With a premature ventricular contraction, if you have a few of them, the heart is not contracting enough to perfuse everything that needs to be perfused, meaning those premature ventricular contractions are not getting oxygenated blood up to the brain or to those vital organs. So having one PVC here and now and that, every once in a while, okay, we probably all have. But if you have runs of PVCs, that can be an issue because you're not getting enough blood pumped out of your heart up to your brain and up to, the important organs in your body. So you'll have a lot of symptoms.
Do these symptoms go in a echocardiogram?
Yeah, I'm not going to get into the
We keep the echo or electrocardiogram?
EKG.
Either one, echo or
You'll see it on an echo, but you'll see it quickly on an EKG because the EKG is picking up the electrical system.
She may or may not feel it. Sometimes people feel them, especially if you have PVC, meaning that the part didn't beat normally, so there's extra blood, so the next beat is kind of big, so you might feel an extra thump just because you have more blood going out, or you might not feel it at all. A lot of people have them and never feel them.
If you have a lot of PVCs, it's called ventricular tachycardia. And that means that there's these runs of PVCs and there is not enough blood being perfused up to your brain. And VTAC is what we call it, is something if we know as a nurse on the cardiac floor, if we see someone going into ventricular tachycardia, we know something needs to be done right now. Maybe either some IV medication, or if the patient starts being compromised, losing consciousness, because if you're not getting enough blood to the brain, that's what happens, then there may be they may need to get shocked. Because VTAC, if not taken care of, goes into VFib, ventricular fibrillation. So when you think about ventricular fibrillation, so just think about it. Remember what atrial fibrillation was. VFib now is just, the heart is just quivering. The heart it's not really pumping anything because it's just quivering. It's that fibrillating. The atrium, the ventricles, that conduction system is really messed up. And you don't survive VFib. There needs to be some type of intervention because the next thing is death because you're just not pumping blood. Okay, so that's when it becomes very serious. We need to know, we've got to take some of this stuff serious if we have irregular heartbeats. Let me talk real quick about heart block because there's three kinds. There's first degree, second degree, and third degree. And that's where the conduction system has a short circuit. And depending on where it is in that conduction system, a first degree heart block just means it's the electrical part has just slowed down some. And there's just a little bit of a delay between the atrium and the ventricles contracting. Second degree, it's a little bit more worrisome because that conduction has lengthened more, and sometimes you skip a beat. So that's a little worrisome. Third degree heart block is very worrisome because there's no synchronicity between what's happening with the atrium and what's happening with the ventricles. So that needs an intervention right away because, again, you're not getting oxygenated blood pumped out of the heart, perfusing the brain. Okay.
You guys know what intervention you would get if you had that?
Pacemaker.
Round of applause.
What was the answer for the viewers?
Oh, a pacemaker. Thank you. Okay, so what are some of the symptoms? What are you feeling if you have some of these arrhythmias? So you may feel it, like, gosh, my heartbeat is really going very fast, or feels like it's just going slow. Or maybe those palpitations. I know we've all have had palpitations, right? Right? Yeah. And you know, if you have them, it's like, okay, it's probably nothing. But if you have a lot of them, it's probably something that should be evaluated. Now, at any given time, you start having some lightheadedness or dizziness. You got to think about what's happening with my heart. And maybe it's not pumping right because I'm dizzy or lightheaded. So maybe the conduction system is messed up. Especially if you start having chest pain. Got to listen to your body because chest pain, it's telling you that something's wrong. And you need to be evaluated immediately. Shortness of breath along with that. Sweating, typically kind of a cold, clammy type of sweat. As a nurse in the hospital, if someone was having some really bad arrhythmias, like a lot of PVCs or runs of VTAC, you go into the patient's room and say, how are you doing? And you can tell the minute you touch them, they're cold and clammy and wet. And that's a very bad sign. Leanne is very warm and dry. And then if your brain's not being perfused, you're gonna have a fainting spell or a syncopal episode. And if you tell your doctor that you fainted and you're not sure why, the first thing they're gonna do is put a monitor on you to see, are you having irregular heartbeats? Is there something wrong with your electrical system? And of course, weakness and fatigue. A TIA, that's a little bit different because we're talking about a blockage in a vessel in your brain with that. So if you go to the doctor because you had any of those symptoms, especially like a syncopal episode or passing out, they're going to place a Holter monitor on you. Has anyone had a Holter monitor? Very good. This is great. And it can be placed, you know, for maybe 24 hours, 48 hours, a week. I think our guest speaker said you had it for 2 weeks, 2 weeks. And so it's just constantly recording what your electrical system is doing. Is it a normal heartbeat? If it's irregular, what is it? How much is it? That kind of stuff. So arrhythmias can be treated with medications or procedures like an ablation. And our guest speaker will talk about his experience with SVT, which is what? A+ for Deidre.
Repeat what she said.
Supraventricular tachycardia. So if arrhythmias are left untreated, they can damage the heart, the brain, or other organs that can lead to life-threatening conditions like stroke, heart failure, or cardiac arrest, meaning your heart stops beating. That electrical system is really important. Okay, so what is an ablation? An ablation is, it's this catheter that's goes up into the heart, and it burns or freezes heart cells to cause some scarring on the inside of the heart. And this helps break up or insulate the electrical signals that cause irregular heartbeats. And this can help the heart maintain a normal heart rhythm. I've got a video that just shows it so much better. Yeah. Okay. So
If you just clicked on that link, you'd probably get there too.
I have to be able to see. Oh, no, I don't think so. Okay. So this person's getting a catheter ablation for atrial fibrillation.
Atrial flutter, ventricular tachycardia, and premature ventricular contractions, also known as PVCs. The catheter ablation procedure is performed in the electrophysiology laboratory of the hospital, where you will be placed on an X-ray table. You may be given medications intravenously to sedate you or make you sleepy. These medications help reduce your anxiety and relieve your discomfort. Your groins will be cleaned with antiseptic, and sterile drapes will be placed to cover your body. A local anesthetic will be administered with a tiny needle to numb the area where the catheters are inserted. You will feel a pinprick and possibly a stinging sensation for a few seconds. Small, thin wire electrodes will then be placed through a vein in the groin. These catheters will be guided to your heart using a special type of X-ray called fluoroscopy. Once in the heart, the electrodes measure the heart's electrical signals and are used to stimulate the heart from various locations to try to induce or start up the abnormal rhythm. Medications are sometimes used to assist in stimulating your arrhythmia. Special software is then used to make a 3D map of your heart and its electrical system to help your physician pinpoint the abnormal tissue in your heart. The catheters are then used to burn or freeze these small areas of heart tissue that generate and conduct the abnormal electrical activity. Upon the completion of the catheter ablation, the catheters are removed from your groin and pressure is applied to stop any bleeding. Following your catheter ablation, you will be moved to a recovery area to rest quietly for several hours. Your heartbeat and blood pressure will be monitored continuously to check for complications. Often, patients are able to go home the same day, but your physician may elect to keep you overnight for monitoring. Be sure to review pre- and post documents on what to do before and after the procedure. As always, if you have questions, please reach out to your doctor's office.
Pretty interesting. So they will, once they get in there, they're trying to stimulate your heart to go into your irregular rhythm. They're trying to make your heart go into SVT or AFib or VTAC. And then unbelievably, this mapping of your heart will show exactly where they need to zap. Now I can remember 15, 20 years ago when Linda and I were in cardiac rehab, ablations didn't have that type of mapping. And it was a little bit of a blind, hope I got it.
But you have to have a lot of faith in your doctor.
Yes. And you also have to sign saying, I may wake up with a pacemaker. Because if they burn too much and no electrical impulses going down between the atrium and the ventricle, guess what? You just bought yourself a pacemaker. So the fact that they can map and see exactly is fascinating. Okay, escape. I'm not sure. I don't think so.
But sometimes for just regular heart cath, they do that. Maybe for this thing to be more bigger vessels.
Okay, I have one last video and then I'm going to introduce our guest speaker. So Linda and I, and is Mary, you're going to remember this because this was 20 years ago in cardiac rehab. We found this video and it's just hilarious. So let me see, what am I doing? Huh?
Full screen.
Oh yeah. So this is a doctor showing you with his body what these irregular rhythms look like. And the arms are the atrium and the legs are the ventricle. That's sinus rhythm. Now, these are some of those premature atrial contractions. And an isolated premature ventricular contraction. First degree heart block.
Oh, okay.
This is a second degree heart block. Winky block is when you drop a beat. Okay, here's a block in the right bundle of his. And then the left bundle branch block. You're getting tired. Now a left anterior hemiblock. Okay, atrial flutter. And here's AFib. See, those atrium are just not even contracting. Okay, this is going to be a whole sequence now. The PVC can turn into VTAC. So that's VTAC right there. And that's VFib. And there's defibrillated. And normal sinus rhythm is restored. Now this unsuccessful defibrillation. Okay, VTAC. Now VFib. Gotta shock him. Shock him. But the conduction was not restored. I think that
The symptoms, does it happen abruptly or is it slowly, you know, when it's, you know, the different.
if you're in some type of arrhythmia and not enough oxygenated blood is getting to your brain, it's going to be instant.
I mean, just gonna happen like that, it's not like that, it's slowly like.
Well, some things like if you have an occasional premature ventricular contraction, and then all of a sudden now you have, you know, maybe it's every other beat is a PVC. it can progress. It can progress. So if you have palpitations or you have had a fainting spell, you need to get evaluated. And the first thing they're going to do is put you on a Holter monitor and see what the heck is going on with your heart and that conduction system. Okay, I want to introduce now our guest speaker, Frank, Francisco, had an ablation. So I don't know if you want to stand, but take it away, Frank. Oh, wait, come over. Yeah. No, come over here so the people can see you.
The people,
You wanna turn your PowerPoint off or keep it on?
No, let me turn it off. Or Leanne, can you turn it off?
I don't know.
Stop share. Okay.
Okay, good afternoon. Yeah. Watching this kind of brings back some memories and stuff that I went through. 14 months ago, I was hiking in the mountains of Spain. And I thought, oh man, it's going to be beautiful. You know, I had been there before, but it was something that I always wanted to do. And after about 3 days of hiking, I started noticing that I was feeling different. You know, I pride myself in trying to keep fit, you know, just healthy. And anyway, as I'm going through this hike, I found myself sweating, rapid heart rate, kind of like I don't want to say acid reflux, but maybe a heartburn. And you know, I should have. I should have probably stopped right then and quit the hike and gone home. But Spain is so far away. I thought, you know, I'm a man up. I'm man up. I'm gonna just beat this and get home in a couple of weeks. Well, you know, I did that, but in hindsight, you know, I'm thinking that could have been a fatal mistake on my part. Because when I got back, I went to go see my doc and told him, I said, Doc, I said, this is what I've been experiencing. I said, I have a rapid heart rate. I said, I have difficulty breathing time, shortness of breath. And I said, I still have this heartburn. And he said, well, you said, you've been hiking up in the mountains, up at 10,000 feet of elevation. He said, maybe a little normal experience there. And I said, but not this. This is different. I said, I know my body. And he said, well, we'll give you a checkup real quick. They give, you know, how the doc, you go in there, they tap your back and, you know, they listen to your heart, look down your throat, all of 2 minutes. Okay. After 2 minutes, he says, you know, look good to me. He said, everything sounds good. He said, I'm thinking what I'm going to do is I'm going to prescribe you some Pepsid AC. And I said, really? And I said, well, Doc, I said, I appreciate the prescription. He said, that's not going to get it. I said, I'd like to have a chest x-ray. I said, I don't know if I have something going on in my lungs. I said, I'd like to have an EKG to rule out something going on in my heart. And I said, I'd like to have one of these stress tests that you get, you know, these treadmill tests. I said, I wanted that. I said, just to mimic what I've been doing when I'm hiking. And he says, well, he says, yeah, he said, I can go ahead and order that. He said that. But tell you right now, you're probably gonna result in negative results. And I said, well, is that what I want? And so anyway, fast forward a couple of weeks, and I've had a heart attack. Find myself in the emergency room, struggling to breathe. My face is numb. I have a rapid heart rate of 220 to 230 beats a minute. Okay, and for the first time, not the first, but one of the few times in my life, I was really scared. I didn't know what was going to happen. But I knew that they had to do something. So they worked on me and kept working on me. And after an hour and a half, they couldn't get my heart rate down. And Doc comes up to me and he says, Francisco, he said, what we're doing is not working. He said, we need to get your heart rate down. And he said, we're going to have to do heart reset. You know, whenever you hear heart and reset in the same sentence, it's not good. It's not good. I said, well, Doc, I said, what does that involve? What does that mean? And he said, well, we're going to have to stop your heart. I said, don't I need that? He said, yeah. He said, we're going to have to stop your heart. And he said, hopefully it'll reset. And all I heard was, hopefully, you know. And so anyway, he said, we're going to inject you with some adenosine, I think. And he said, it's going to slow your heart down and stop. And he said, you're going to feel weird. He said, probably the weirdest you've ever felt in your life. And I said, what if I don't want to do this? He said, well, we don't know how much longer your heart is going to be able to take this. He said, these 230 beats a minute. He said, you may not be able to survive. And I said, well, okay, go ahead. So they injected. And next thing I know, I'm somewhere, but I'm not there. And I can hear them, but I'm not moving. And all of a sudden, boom, I'm back. I'm back and I'm gasping. And they are working on me and stuff. And I hear her saying, well, 80, 120, 160. She's counting off the heartbeats and they're monitoring it. 210. And they said, oh, you got to slow them down, got to slow them down. So they give me some, maybe more adenosine, but it's too much. The next thing I know, I'm going down. Heart rate is plummeting. And now I'm down at 40. At 40. And I'm struggling to breathe. My face again is numb. And they give me something else, and now I'm going the other way. So I'm like I'm on a roller coaster, up and down with my heartbeat. But eventually, these wonderful nurses and doctors, they got me to regulate, and I was able to make it through that night. In the morning, I woke up and the doc is there, and he says, Francisco, he said, how you feeling? I said, like I got run over by a truck. And he said, the good news, he says, is that you made it. And he said, you've got a strong heart. He said, we said, we need to go in. He said, and do a test. He said, to see how your blood vessels are moving the blood in your body and see what kind of blockage you have. And he said, then we can deal with it. And he said, maybe stent it, whatever we need to do. He said, in a couple of hours, you're going to come in, prep you, and then we're going to move you in for the procedure. I said, okay. So 6 hours later, I'm done with the procedure. I've recouped in the recovery room, and they're wheeling me back to my room. Well, so I get there, my daughter and son are over there, and they're just weeping. They're just crying. But they're not sad tears. They're happy tears. Happy tears to see. And I opened my eyes. I said, gonna be all right, huh? Gonna be all right. And so anyway, I rested, and a few hours later, Doc comes in. He said, well, he said, the good news, he says, is that he said that we were able to stent in, 2 stents in. He said, can't release you right away. He said, you're gonna have to stay a couple of days. He said, see how you do, and if there's no complications, then we'll send you home. I said, great. So 2 days later, I'm on the way home. I get there and I'm relaxed and just trying to recoup. Day goes by, and damn it, I'm starting to feel weird again. My face is flushed, heart is racing. I just keep breathing. I look at my watch, my iWatch, and press it. I'm at 190. 190. And my daughter's there. And I said, honey, I said, you're going to take me to emergency now. So we race to emergency. I get there, heart rate 210. Okay, they hook me up. They give me some more adenosine. And I'm there, and they are working on me. And this time after 4 hours, calm and regulated, and they discharge me and send me home. And before they send me home, they say, we contacted your doctor. You've got an appointment tomorrow morning to see your cardiologist. And I said, okay. So I go in the next day, and I talked to the cardiologist. He said, you've had an SVT episode. And he said, we're changing your medications, putting you on this beta blocker here to slow down your heart rate and get everything back to normal, or as normal as you can be. And he said, see you in a couple of weeks. And I said, okay. Went home. 3 days go by. Boom. Again, my heart is racing. I'm headed to emergency again. Well, this doesn't happen another time, but happens 3 more times. Yeah, I'm 10 minutes from the hospital. It's quicker for me to get there than to call 911. So anyway, I go in 3 more times, and cardiologist meets with me, and he says, so we're going to put this halter on you, this monitor. He said, made a referral for you to see a cardio physiologist. There you go. Cardiac physiologist. And he said, see what's going on and see if they can correct the SVTs that you're having. And he said, it's about 3 weeks out. He said, with the medication that you're receiving, we're hopeful that it'll control. He said, here's an extra pill here in case you gotta start having an SVT. He said, go ahead, pop one of these. It's Cardidol, I think it was. Cardidol is the name of the medic.
Carvedilol.
Yeah, probably.
The beta
Anyway,
blocker,
it's a beta blocker. He said, if you need to take this. And luckily, I didn't need it. But anyway, went in to see a specialist. And he tells me, he says, well, I've conferred with your cardiologist. He said, I know what's going on. He said, yes, you've been having SVTs. He said, in fact, you're having them with more frequency than we would expect. And he said, that scares us. He said, if left unabated, he said it could result in cardiac arrest or death. And he said, I said, well, doc, I said, what can we do? I mean, because I'm scared. I'm scared I'm not going to be able to do anything. I'm going to have to live with this for the rest of my life. And he says, well, he said, we've got a procedure. He said, it's an ablation procedure. And I, like people in here have never had it, said, what's that? And he said, well, essentially, he said, we go into your heart. He said, we run some catheters up there. He said, we map your heart. He said, we can see the electrical signals that your heart is sending out. He said, because he said, basically with an SVT, he said, you're having irregular signals sent. And he said, your heart doesn't fill up. And he said, you feel lightheaded. He said, you feel like you can't breathe. And he said, you can't. He said, that's what's happening. And he said, chamber's not filling up with enough blood. And I said, well, with the ablation, what do you do? And he said, well, we send 2 catheters up each leg, one up each leg. He said, one has a camera. He said, the other has a kind of like a laser. He said, we'll map your heart. It's a 3D map. He said, we induce an SVT. He said, your heart will start beating rapidly. He said, we'll map that. And he said, then we'll go back and we'll laser those points. And he said, it'll essentially kill those areas where you're having your SVT. And I said, will I get rid of it? He said, we're going to have to do that a number of times. He said, it's just not going to be one time. He said, so we'll induce an SVT, go in, and he said, zap it and wait again and do He said, it's kind of like wash, rinse, repeat. And he said, eventually, he said, it won't light up anymore. He said, and then we'll think that we got it all. He said, most of the time, he said, you're a pretty good candidate. He said, you're healthy. He said, other than what you've been through, he said, you look like you could withstand this procedure. I said, great. So 3 days later, I went in for ablation. They had me in at noon, and they went through the procedure. By 6 that evening, I was on the way home, or actually out of recovery, getting ready to go. And they came in and asked me how I was feeling, asked me if I had felt anything. And I said, no. I said, I know that I wasn't out all the way when you did that. He said, yeah. I said, I was groggy. He said, yeah. He said, did you feel any pain? I said, no pain. I said, but I could feel you. I said, it kind of felt like a fingernail. I said, but I could feel it. And I said, I'm okay. And he said, any pain here in the groin area? When we had the catheters inserted. And I said, no. I said, no pain. I said, it's a little sore. I said, but not painful. And he said, well, okay. He said, we're going to send you home in a couple hours. So they sent me home, and for the next 3 days, they were monitoring me and calling, making sure that everything was okay. And about 3 weeks later, I went in to see that specialist again. And he checked me out, and they gave me an EKG. They monitored my heart. They looked at all the graphs that were produced. And he said, we don't see any irregularities. He said, everything looks normal. He said, but what we're going to do, he said, is we're going to send you to cardiac rehab. Here they call it cardiac wellness. Same thing. He said, you'll go to cardiac rehab for a month. He said, if after a month everything looks good, then we'll graduate you. And so after a month, I graduated, and I started working out again, started training, because in June, I was going on another hike. This one was 330 miles. And, I wanted to do this along the coast, Portugal, beautiful. So I wanted to get this done. Well, I got it done. And, I was lucky. I went back to see my doc, and he said, you're one of the fortunate ones. He said, you listen to your body. He said, a lot of people, he said, when your body started speaking to you on that trail the first time, he said they didn't listen to their body. He said, like you didn't. He said, but you were lucky. He said, we could have found you on that trail. He said, but he said, you made it through, and he said, you're gonna be okay, and hopefully other people like you will learn. And that's why I'm here today. So, I'm open to any questions you might have. I know that I didn't cover everything like a nurse would, but in layman's terms.
So have you seen the doctor that gave you the Pepsid again?
Yeah, I have. I see him twice a year. Actually, once a year. I have mandated. It's through Medi-Cal or Medicare. You have to go in once a year. Okay. And the crazy part about it was this. When I was seeing my doc, the cardiologist in the hospital, he says to me, well, we got in touch with your GP, and he told us that he was the one who sent you to see cardiologists and stuff. I said, okay. Yeah. But anyway, so once a year at least, go to see him. Yes.
Do you have a pacemaker?
No.
At any point they recommend?
No, I don't need a pacemaker. Everything is, as far as my heart is concerned, when they zapped all those different points in my heart is now functioning normally. Okay, And that's why I was released from cardiac rehab, and that's why I was able to continue my daily activities, work out, and go on hikes. Next year, I'm going to Italy to do another hike.
Francisco, Karen's asking what medical system you belong to.
I belong to Sutter, and I guess it's Sutter Rosewood.
Yeah.
Yeah. So,
Thank you.
okay.
Kind of a question for the nurse. So in the electrical system, I'm gonna assume that there was some renegade cell that just decided, hey, we're gonna cause problems and decide to cause the electrical system to go off. And that those cells are what are being frozen or heated up. And there's nothing that can stop a bunch more cells from just kind of, hey, we're gonna go do the same thing a week later or 2 weeks later, even after they do that. Or maybe it's what makes cells want to do something like, I'm gonna leave the group or and just go off on our, you have that little group that just decides, I don't know how they do it. We're gonna wander off and form our own little node that makes everything crazy. There's something to that, but that you can prevent that from happening in the
I don't
beginning.
think you can prevent that. I'm thinking like if you've had some type of event, like if you've had like a heart attack and part of that electrical system was affected in that area, you're not getting enough blood in that area and died on that pathway, that would cause, some irregularities. But I don't think there's anything you can do to prevent, having. Well, I can't think about, people who do a lot of drugs like cocaine and methamphetamines. They typically have SVT. Yeah, so don't do drugs.
I will tell you this, one of the things that the cardiac specialist told me, he said that I probably had SVTs all my life. He said, but as a child, as an infant and a young child, he said, you really don't notice it. And he said, you're always running around, being active. He said, so you probably don't notice it, and your body kind of recoups, And he said, where we see SVTs, he said, there is in people that are in their 30s and athletes. He said, those are the people that are more susceptible to SVTs at a younger age. So,
Did you ever identify any triggers like caffeine or overexerting yourself or stress, getting mad at your wife that would throw you into it?
yeah. Probably the wife is experiencing more stress. But no, as far as triggers, the trigger that I had again was probably when I was up on that mountain.
Elevation.
Yeah, the elevation change. That's what I thought it was. I thought my body was having a difficult time acclimating to the elevation change, and that maybe I just didn't wait long enough to kind of adjust to the elevation, or that I wasn't resting enough between spots where I got tired, that kind of stuff. But I guess my takeaways would be this: since I didn't do this, listen to your body.
What does that mean exactly?
That means if you are experiencing something that doesn't feel right to you, like me, when I was doing that first climb, my body was telling me something's wrong, but I ignored it. And like the doc said, they could have found me up on that mountain dead. But he said, listen to your body. And he said, if it doesn't feel right, he said, stop.
You had your heart attack after the first
Yeah,
time?
after I had my heart attack when I came back from climbing in Spain.
And then after your heart attack, you still went climbing? in
No,
Portugal?
no. After I had my heart attack and the ablation and cardiac rehab, after I completed all that, then I went hiking again.
So you didn't learn that lesson?
Well, no, I don't have the issues that I had
But your
before.
doctors were okay with
Yeah,
it? They
yeah.
said you could go climbing?
They told me I could do everything, live a normal life. He said to me, he said, and this of course is in jest, but probably real. He said, you've got the heart of a 25-year-old. That's what he told me. And again,
Jody has a question.
I also had an SVT on the 4th of July about. And at a party. And I just knew that I didn't feel well. My friend is a nurse and she was sitting next to me and she took my pulse and she said, we gotta get you inside. So we went to the fancy country club place, we went inside, we gotta call an ambulance. So they did, and they had to shock my heart on the way to the hospital. And, I had a procedure and one of the nurses can help me. They surgically implanted a small microchip into my left breast. And for 3 years, I was attached to the iCloud somehow, and they could tell if something was going wrong, and they would call me right away.
sounds kind of like a Holter monitor.
It's the same thing as a Holter, but since it's continuous, that's why it's internal. Yeah, and it didn't stop me from going through anything at the airport. Did you have more SVTs while you had that in? Pardon? Did you have any more SVT? No, I haven't had one since, and they wanted to take it out, and I talked to a friend of mine at church that's a cardiologist at UC Davis, and he said, if it's not giving you any problem, it's just leave it in there. And so I saved the government couple $1,000 or whatever. It's probably not transmitting. I haven't had any problems. What if they could turn it back on again if you need it? It's kind of curious. I don't know. I'm sure it's not transmitting currently. I think probably it wears out after a while or something. I can't feel it. I have no idea that it's there.
Yes.
You were
Question to
stented
the
twice,
nurse.
so there must have been blockages.
What
And
issue?
they
Oh, wow.
identified blockages anywhere else?
No, what they did is they identified blockage in my heart there, and I was 90% blocked in one artery and 80% blocked in the other. And the doc did tell me, he said he was surprised, amazed that I was able to make that hike. He said, I don't know how you made it. He said on half a heart.
Wow. But those are separate issues. So you had some atherosclerosis, some blockages in your arteries, plus you had a conduction issue, and maybe one caused the other or vice versa.
Yeah.
You don't know that, but you got them both taken care of. So that's the good
Yeah.
thing.
Yes.
So, when you came back from Spain, you said you saw your doctor. Was that just your,
It was GP.
okay? And prior to that, did you have a cardiologist or? Was
No, I'd never, other than yearly physical or physicals, I'd never had an issue. I've been healthy for pretty much all my life.
So when you went, I take it you don't live alone
Right now, my daughter lives with me.
since that happened? or-
Yeah, since that happened.
So it's scared, like, well, you know. I just was wondering if it was safe for you to go home. Well, you said your daughter was with you after the procedure.
Well, in hindsight, when I was hiking, I've often thought of this because the trail that I was walking it for days alone. Okay, because up in the mountains, you don't find too many people that are going to be taking a weekend off to go hiking at 10,000 feet. Okay, so I'd hike for days, and I might come across one or two people. Okay, and it reminded me of a friend of mine. He said, he said, you're lucky. He said, God protects children and fools. You know that one. In regards to diet, in regards to
Diet or?
the restrictions that I have are that number one, I shouldn't drink any caffeine. Okay, I don't drink or smoke, so it's not an issue. That as far as weight training is concerned, because I work out 4 to 5 times a week. Okay, they don't want me lifting anything over 50 pounds. You know, when I first got out of the hospital, they said nothing heavier than a quarter mil.
Yeah.
You know, but as far as working out restrictions, just working out and listening to my body. Said,
So was caffeine something you had to give up, or was that nothing you ever used?
I used to drink a little caffeine, mostly tea, but still tea does have caffeine unless you drink decaffeinated.
How about sex? Drinking wine.
What's that?
How about sex?
Sex? That's an interesting question because after, yeah, we may have to go take this up something. After I had my ablation and stuff, the doc told me, he said, you probably can engage in sex. He said, but he said, I would wait until after we give you clearance. He said, I think it'd be safer. He said, not that you probably couldn't tolerate it. He said, well, let's wait. So I waited for a month after relation.
You got the clearance.
And I got the clear. Yeah.
By the way, I'll be speaking with non-traditional during the subject.
Yeah.
And I have a question. What initiates these signals to begin with? Does it come from the brain or is it
No, it's
inherently?
just, I think the heart is spazzing out completely on its own.
So it has nothing to do with the brain?
No.
Because it would seem to me, it seems like there is a software that controls all this. And then somebody hacks into it and starts doing weird things. And so maybe if they could get into this software and address this, it'll be okay.
I don't know.
What I kind of look at that kind of stuff is I see it as you've got a motor or something that's functioning great. You know, it's in your car, it's running great. All of a sudden you get a short. That to me is what I think you're talking about, something like that. It just doesn't work the way it normally does, and it keeps shorting out until they fix it.
Yes, and I would think, in this day and age with AI, they would probably put monitors and not just to pick up the signals, but to immediately put in corrections to do it.
Oh, yeah.
So it would pick up abnormality, address, pick up abnormality, address, rather than just, say, okay, you're gonna die, or, you need to go to.
Give us 10 years.
Yeah, we may not be there.
I think it's gonna come much
To
sooner.
some extent, that's sort of the people that have quote devices, they have implantable defibrillators. Those are pretty sophisticated things that actually do some of what you're saying, that they detect things. And if you have an implantable defibrillator and you start to have a heart block, or you start to go and detect that the system knows it and it does stuff to,
Does it automatic?
yeah, it detects that, but it's all within your heart. Your brain is disconnected from that process to be, just illustrates how specialized your heart cells are, that some of them, and again, that's where triggers might help. Maybe people might be more reactive to certain stressors than others. And so if stress or caffeine or things basically make those cells more excitable, then if you can learn some stuff and talk yourself out of being stressed, you might control these heart rhythm issues, possibly. Depends on what's going on and what are your triggers, and you didn't really have any triggers.
No,
so-
I do meditate. And I don't know if that kind of wards off any triggers or
Right, so
whatever.
that's where a lot of the medicines that you take basically tone down some of those excitable cells, the beta blockers is particularly. Fascinating. Thank you so much, Francisco.
Okay.
Francisco,
Yes.
Francisco,
Yes.
can I ask one question? The
Sure.
doctor that told you to listen to your body, was that your GP or your cardiologist?
My cardiologist.
Uh-huh. And I would say that an even stronger message, what you did was very assertive in that you overrode your GP's, not wanting to, or not encouraging a lot of testing. He didn't see any real point in that. But you said you went forward and persisted. And I think people, and not everybody has your level of assertiveness, but they need to remember that they are in charge and not to worry about costs and that kind of thing. So, I think listen to your body, but the very most important thing is speak up and continue to speak up if you need to.
Yeah, self-advocacy, we
Yeah.
call that.
Oh, absolutely. I mean,
You're your strongest advocate.
Right.
I can't even say it often enough. People put doctors on such a pedestal or anybody in authority, and they're afraid to speak up. They're intimidated, or they don't want to offend them. And they're only human. So, yeah. Thank
Okay,
you.
Thank you, Karen. Don't go away,
Is he still
Karen.
your doctor?
Yes, he's still my doctor. You're talking about my GP.
Yeah.
I got
Yeah.
you.
It's so hard
Yes.
to switch